Will Vermont officials change their guidance on the treatment of fever or pain during pregnancy? It comes after the Trump administration announced the new recommendation that pregnant women should not use Tylenol due to possible ties to autism. Dr. Jan Carney, Associate Dean for Public Health and Health Policy at UVM's Larner School of Medicine, joins us now with more information. What is your department's recommendation now for expectant mothers treating pain or fever?
I can speak to you as someone who has a lot of experience in medicine and public health and interpreting science. And I think that the recommendations or the latest news about acetaminophen use in pregnancy and possible connections with adverse birth outcomes was quite confusing to people. My suggestion is that you continue to follow the science and the recommendations of national professional organizations, such as the American College of Obstetrics and Gynecology, who have been studying this for decades. The FDA information said there was no causal association found or documented between the use of acetaminophen during pregnancy and adverse outcomes such as autism and ADHD, among others. So I think we can be very reassured both from large international studies, decades of scientific evidence, as well as recommendations from large, credible national professional organizations that patients should continue to have confidence in recommendations from their own healthcare professional.
From a medical teaching standpoint, what do you tell students who may become doctors about how to make their recommendations and decisions in the future?
Base them on science and good public health science and medical practice is based on evidence, not just opinion. And you use those decades of science and that method that we've used over and over to help us understand how to prevent and treat diseases. And they really have to be critical observers of that. If you hear something that doesn't make sense, ask, how do they know? And if you can't find anything that is based on scientific evidence, you should question that indeed. And we do teach our students that in the way that we have used science for many, many years and decades, and that is the best approach for our patients.
Dr. Jan Carney, thanks for your time.
You're welcome. Thank you.